Malaysia diletakkan sebagai antara negara yang mempunyai paling ramai penduduk dengan berat badan berlebihan di Asia.
Obesity has become a global public health concern since 1975. In 1997, the World Health Organization declared obesity as a major public health problem and a global epidemic. In 2016, more than 1.9 billion adults were overweight and 650 million were obese. At least 2.8 million people each year die as a result of being overweight or obese. Obesity is becoming an increasingly severe issue each year. And as we all know, Malaysia is one of the countries with the highest obesity rate in Asia, with the highest prevalence of obesity among adults in Southeast Asia at 15.6% and in Malaysia 19.7% of adults were overweight. With the COVID-19 pandemic situation and the implementation of Movement Control Order MCO, without us noticing, the obesity rate in Malaysia is increasing dramatically. The increasing number of overweight or obese citizens in Malaysia is not a surprise considering that they were homebound and less physically active.
The main cause of obesity is because of poor dietary intake. According to a research conducted by Nurse Health Study, in a 8 years follow-up, increased energy intakes from animal, saturated and trans fats were positively associated with weight gain, particularly in overweight women. Women who were light to moderate drinkers, which consume up to 30 grams per day, were less likely to gain weight than non-drinkers or heavy drinkers. Meanwhile, women who increased their daily intake of water or coffee without added sugar able to lose their weight in a given 4-year period, whereas those who increased sugar as in sweetened beverage or fruit juice intake gain weight. The next cause is physical inactivity. Study shows each 2-hour daily increment spent standing or walking was associated with 9% lower risk. Meanwhile, an hour per day of brisk walking was associated with 24% lower risk of gaining obesity. It is said that jogging and running appear to be the best for limiting weight gain. Brisk walking and bicycle riding are inversely related to weight gain. Lastly, sleep duration. Based on a 16 years follow-up, women who sleep 5 or fewer hours at night were 32% more likely to gain weight. Meanwhile, those who sleep 6 hours were 12% more likely to gain 15 or more kilograms than those sleeping 7 to 8 hours.
I don't want to be fat for the rest of my life. I've got diabetes,
Sleep apnea.
high blood pressure.
I get dizzy when I get up.
Everything's hurting now.
Saya asalnya tak adalah seorang yang obes sewaktu kecilnya, tapi selepas start sekolah rendah tu, saya makin lama makin besarlah. Yang saya ingat, saya darjah 6, saya dah memiliki berat badan 60 kilo.
Then, Fikri started to gain more weight. At the age of 34, Fikri was experiencing a lot of health problems because of his obesity. His blood pressure always high when he went for medical checkup, and he also has diabetes. In 2014, he started getting extremely high blood pressure and minor strokes for 4 times. Due to that, he referred to a general surgeon to get his surgery for obesity. Obesity and arthritis are linked to the weight of the body and associated with obesity. Intra-abdominal pressure associated with esophageal disorders increases the anatomical impact. The increase in consumed subcutaneous adipose tissue will increase the weight of the body. Obesity also can lead to cardiovascular disease. Approximately 17.9 million people die from cardiovascular disease annually, which is 31% of all deaths worldwide. Ischemic heart disease and stroke are the 2 most common causes of mortality worldwide. Plus, obesity can cause type 2 diabetes mellitus. The most recent data shows that in the United Kingdom, 4.7 million individuals are diagnosed with type 2 diabetes mellitus, equivalent to 6% of the UK population. The risk of type 2 diabetes mellitus was associated with a BMI in the range of 30 to 35 for 5 times and would rise to 12 times more for those with a BMI of 40 to 45.
Next, the past efforts by the government. The increasing number of obesity people makes everyone worry about it. To address this worrying health trend, the government has introduced many ways to address this issue. One of them is, the Health Ministry has introduced sugar-sweetened beverage tax. The introduction of a new tax on sugar-sweetened beverage is a lead of strategy by the Malaysian government to reduce the consumption of these sugary drinks and tackle child obesity. Another program is, Malaysians have been asked to walk 10,000 steps a day as part of their healthy lifestyle regime. The Health Minister at that time said the 10,000 steps a day campaign was intended to push the people to improve their health by walking more and reducing their intake of unhealthy food. In 2019, UNICEF had given awareness by having a UNICEF Borneo Marathon to promote better nutrition with the theme #Kurang Manis because #I am sweet enough. The marathon aims to promote healthy eating habits among children and adolescents by encouraging participants to kurang manis, which means to reduce sugar intake.
This is Eileen. She loves to eat. One day, she weighed her body on the scale. She was very shocked when she looked at the number on the scale. She realized that she is overweight. The next day, she met her friend Shira. Then, she shared her story to Shira that she is overweight. She wanted to lose her weight. Then, Shira suggests her to join
National Youth Health Campaign Fat to Fit. With joining this campaign, she will not only lose her body weight, but she will have a healthy lifestyle after this. Eileen interested to join the campaign.
Changing your eating lifestyle is the crucial part in solving this problem. For most men, it is advisable to consume less than 1,900 calories a day, and for most women, no more than 1,400 calories daily. Practice the balanced quarter-quarter-half diet, which means consuming a quarter plate of protein, quarter of grain products, and half of vegetables, which consists of a lot of fiber.
Besides changing your eating lifestyle, you should also increase daily activities and move around. You should do at least 10 minutes of physical activity such as taking up the stairs, carrying your grocery bags, and so on. Having intense exercise for at least 30 minutes 5 times a week would definitely help you to overcome this problem. Go to the gym and work out. You could also jog or even walk for 30 minutes.
Other than that, changing your daily lifestyle is important too. You need to avoid sweet drinks and carbonated drinks as the sugar level is definitely high. Drink at least 2 liters of plain water to normalize blood pressure and heartbeat. Try to avoid fast foods and snacks that contain high levels of salt because they can raise your blood pressure, which can be dangerous for people who are already obese.
In the Quran, there are several ayah that guide us in taking care of our eating habits. In Islam, we are allowed to eat whatever we wanted but under some regulations. This is clearly to avoid the bad side effect that we already mentioned before. In Surah Al-Baqarah verse 168, Allah said to eat of what is lawful and wholesome on the earth, which means we can eat anything as long as it is halal and allowed according to Sharia. In Surah Al-A'raf, Allah stated that, eat and drink but avoid excess. As we know, Islam practices modesty in many aspects, especially in eating. This ayah clearly meant that we can eat and drink but with limits in order to avoid bad effects to our health and also avoid waste. There are more explanations related to this ayah, which is in a hadith narrated by Ibn Majah. He narrates that the Prophet Muhammad, peace be upon him, stated that in order to avoid excess in meals, people should fill 1/3 of their stomach with food, 1/3 with water, and allow 1/3 to remain empty. This practice can avoid overeating and also prevent from obesity or overweight. Also, in another authentic narrated by Muslim, Prophet Muhammad said, the food of one person will be sufficient for 2, and the food of 2 people will be sufficient for 4, and the food for 4 people will be sufficient for 8. Majority of scholars also agreed that obese because of overeating is forbidden as Islam is a religion that emphasizes modesty.